Welcome to this explainer. We're going to dive right in and separate the sci-fi hype from the actual, everyday hospital reality of artificial intelligence. If you've been following healthcare tech, you know AI is absolutely no longer a futuristic concept. It's here, right now, and it's fundamentally rewiring patient care. But beyond all the buzzwords, what does having a digital co-pilot actually look like on the hospital floor? And how on earth are these algorithms navigating the incredibly strict, complex regulations across the globe? Well, today, we're breaking all of that down to see exactly how this tech is saving time and, way more importantly, saving lives.
Before we even look at our roadmap, consider this truly wild statistic. 79% of healthcare organizations are actively using some form of AI today. I mean, we are way past the experimental, early adopter phase here. This represents a massive, system-wide shift toward digital medicine. It's happening right now in clinics and hospitals all around us.
Okay, here's our agenda for today. 1. AI on the hospital floor. 2. Transforming daily clinical workflows. 3. Saving lives, sepsis and imaging. 4. The global regulatory landscape. And 5. The future of care.
Section 1. AI on the hospital floor. Transforming daily clinical workflows. To really grasp the true impact of AI, we've got to look at the core problem facing hospitals today, and that's burnout. Currently, 35% of clinicians report spending more time on paperwork than actually caring for patients. Another 45% report an equal split between patients and paperwork. Think about your last doctor's visit. How much time did they spend staring at a screen instead of actually looking at you? This administrative overload is quite literally one of the single biggest obstacles in modern medicine. The healthcare workforce just cannot scale fast enough to meet growing patient demand just by hiring more people.
And this perfectly illustrates why physicians are so eagerly turning to AI. You see, the most immediate, widespread relief AI offers isn't about replacing medical judgment. It's about lifting that crushing administrative weight. Notice how high the demand is for just everyday tasks. 57% of physicians plan to use AI for translations, 56% for discharge instructions, and 55% for bill and code documentation. Physicians are highly motivated to integrate these tools into their daily practice so they can finally get their time back.
So, the absolutely crucial takeaway here is that the biggest immediate value of AI is not replacing doctors, it's rescuing them from data entry. In fact, 57% of healthcare organizations identify reducing administrative burdens through automation as their absolute biggest opportunity for AI adoption. To put that into perspective, nearly 60% of all recent investments in healthcare AI were directed squarely toward these exact kinds of administrative tools.
Enter the Ambient Scribe. By using these tools, clinicians can reclaim their time and focus entirely on the patient sitting right in front of them. These tools basically listen in the background, securely document clinical routines, and seamlessly organize medical discussions. And the adoption rate is staggering. 30% of providers already deploy these system-wide, with another 40% actively piloting them. It's a real game changer. It's allowing doctors to actually look their patients in the eye again, completely transforming the bedside experience.
Section 2. Saving lives, sepsis and imaging. Now, this is where AI transitions from a helpful administrative assistant to a critical clinical co-pilot. Let's look at how this algorithm handles sepsis. Sepsis is incredibly time-critical, right? Early intervention dramatically improves outcomes. In step 1, these AI models monitor massive, continuous streams of vital signs, lab values, and nursing notes in real time. In step 2, the AI algorithm conducts continuous analysis of all those data streams. And finally, in step 3, the system triggers a preemptive clinical alert for early intervention. What's really mind-blowing about this is how the AI can catch subtle, hidden patterns of deterioration hours before a human normally would. And that leads directly to reduced mortality and shorter ICU stays.
Beyond predicting infections, let's contrast standard manual radiology with AI computer vision. While manual review relies on the highly skilled human eye, it can be naturally prone to fatigue, and, let's face it, it's limited to slower manual analysis. AI models, on the other hand, act as this tireless second read. They analyze thousands of scans instantly to flag urgent, hidden malignancies for immediate human review. They are definitely not replacing the radiologist. Rather, they prioritize work lists and catch exactly what the tired human eye might miss.
The results of this partnership are just incredible. Computer vision algorithms have demonstrated the ability to reduce diagnostic errors by up to 20% in complex cases. Whether it's identifying brain tumors, breast cancer, or diabetic retinopathy, this technology acts as a vital safety net. Imagine if this were your scan. Radiologists using AI can detect lesions 26% faster and identify nearly 30% more cases. That translates directly to human lives saved. Section 3. The Global Regulatory Landscape. Balancing Innovation and Safety.
Now, with all this clinical power comes the need for strict governance. To understand global policy, we first need to define SaMD. That stands for Software as a Medical Device. This is software intended to be used for medical diagnosis, treatment, or prevention, and it's regulated independently from physical hardware. Basically, if an app merely stores your step count, it's just an app. But if it actively diagnoses or treats a disease, it falls under strict regulatory oversight. This classification is the global baseline for keeping patients safe.
When we compare how different nations handle these SaMDs, some really fascinating contrasts emerge. The United States is FDA-driven, leading in sheer volume with over 1,400 device approvals, though it does have to navigate heavily fragmented health data systems. Meanwhile, countries like Japan and Saudi Arabia are taking highly specialized, strategic approaches to leapfrog those legacy hurdles. Japan uses the PMD Act and DASH strategy for fast-track reviews and agile software updates. Saudi Arabia uses the SFDA and Vision 2030 for a massive top-down government shift from curative to preventative care. Let's look a little closer at those two.
Japan's regulatory journey perfectly highlights how to balance rapid innovation with trustworthy governance. Under their PMD Act, they approved their first therapeutic app for nicotine dependence back in 2020. Fast forward to 2024, they released the AI Business Operator Guidelines, which provides streamlined regulatory support. But what's really brilliant is their upcoming 2025 AI Promotion Act. This emphasizes voluntary compliance and trustworthy AI use, creating an environment where a medical device can continuously learn and update itself safely without needing a completely new approval for every single software tweak. Meanwhile, Saudi Arabia is using a clear top-down government mandate to deploy AI at a national scale. Under Vision 2030, they mandate a fundamental shift from curative to preventive medicine. They are connecting over 150 facilities via the Seha Virtual Hospital, and they heavily use predictive AI to target chronic diseases like diabetes early. And they're doing all of this while regulating clinical AI strictly based on risk levels via the SFDA. It really proves that rapid innovation and strict patient safety can absolutely go hand in hand.
Section 4. The Future of Care. Augmenting Human Expertise.
We've seen how AI removes administrative bloat, catches invisible diseases, and is being carefully governed across the globe. As we conclude this explainer, I'll leave you with a final thought to ponder. As the era of augmented medicine accelerates right into our hospitals, will AI replace the clinician, or will clinicians using AI replace those who don't? The evidence strongly points to the latter. When doctors are freed from their keyboards and armed with tireless, data-driven co-pilots, they can finally get back to what they do best: human-centered care. Thanks so much for joining me on this deep dive into the real-world impact of healthcare AI. See you next time.